This is Satish Tope. Today we are going to see a clinical trial paper. So that paper is going to focus on the evaluation of the efficacy of the Pimavanserin in the treatment of agitation and aggression in the patients with Alzheimer's disease. Psychosis in Alzheimer's disease is one of the severe problems. Already we know that Alzheimer's disease is one of the severe problems. On top of that, when we add psychosis, the symptoms and the patients undergo much more severe issues. The psychosis in Alzheimer's disease patients will have the following symptoms. They have the rapid cognitive decline, and the neuroimaging indicates greater cortical synaptic impairments than Alzheimer's disease patients, greater gray matter reduction, reduced regional blood flow, and reduced regional glucose metabolism. Overall, they see an increase in short-term mortality of these patients. And when we consider the pathology of these patients, the neuroimaging studies show that these patients have the neocortex affected more than the medial temporal lobe. And in postmortem analysis, what we see is like they have accelerated accumulation of hyperphosphorylated microtubule that's associated with protein tau compared to Alzheimer's disease patients. And it is assumed that it is genetically mediated, although no particular gene has been established so far. So what's the need for this particular study? So unfortunately, even the severity of this of the psychosis in Alzheimer's patient, there is no approved treatment yet. Only modest benefits by anxiolytics or typical and atypical antipsychotics are available for these patients. Pimavanserin is currently approved by United States FDA for the treatment of hallucination and delusion, the psychotic disorder associated with Parkinson's disease. And what they have seen is that there is a positive effect of Pimavanserin in improving the psychotic symptoms in Alzheimer's disease patients also. Now, they want to do further clinical trial to understand whether this particular improvement that they are seeing on the psychotic patients will have the same benefit when there is agitation and aggression in those patients. So the study overview says like that the goal of the study is as follows. So they want to assess the efficacy of the Pimavanserin on agitation and delusion for responders and non-responders. Here they define the people or responders when they show some improvement on the psychotic symptoms after taking the Pimavanserin for 6 weeks, and the non-responders are those people who don't show any improvement. And the evaluation methodology that they use is by going through the score from Neuropsychiatric Inventory Nursing Home version. And also the Cohen-Mansfield Agitation Inventory short form version. And a simple analysis of these scores like this are like series of questions, and then you rate from scale from 1 to 7. For example, in Cohen-Mansfield Agitation Inventory, there are like total around like 29 different questions, and each question carries a score from 1 to 7. For example, have you had any kind of agitated feeling? Some kind of questions like that. And the procedure that they conducted in this study is basically it's a 12-week study. It's a double-blinded with a placebo on control on phase 2. And the patients were selected from the nursing home with the criteria that they should be at least 50 years old. And they have the NPA-NH score of greater than 4 and a CMI delusion hallucination score of greater than 6 actually. And the analysis was done at the end of 6 weeks. Total 181 patients from 133 nursing homes were given, or at least were selected, and out of them 90 were given the drug, and then 91 were given placebo. So after the initial study, so the result is divided into 2 sections actually. So one section is where on the baseline the patients were showing normal symptom of agitation. Like I mentioned, the score, the NPA-NH score would be a 4 actually. That's considered as like normal symptom of agitation. And for those people, when they give this particular drug for both responders and non-responders, what they see is like the patients who are considered responders. Those are the patients who respond to the treatment of psychosis, and those people when they given this particular drug, they also see an improvement in the agitation and aggression score actually. This after 6 weeks of trial, the patients, the responders, they have a decreased score in agitation and aggression of 3.64 when measured on the NPA-NH. On the right hand side curve, as we always do, we want to see what's the x-axis and y-axis. The x-axis is the number of weeks. Like I mentioned, the analysis was done for 6 weeks, and the y-axis was changing the score from the baseline. The baseline for NH score was around like 28.4, and they want to say like how much from the baseline score has reduced after the treatment after 6 weeks. And as the right hand side graph shows, they see around a reduction of minus 3.71, so reduction of 3.71 for responders, and in the case of non-responders, they don't see any benefit of this drug. And the result too, they are considering the patients with severe symptoms. Severe symptoms are those people where the NPA-NS score is greater than 6, and for those people, as the left-hand graph shows, the responders show again a improvement in the overall score reduction. So the delta between the responders and non-responders are around like 3.03. There is some improvement on the non-responders, but it is not as significant as we found that on the responders. On the right hand side is the same graph, similar graph, but the score is CMAI. It's another metric of evaluating the agitation and aggression. And what they see is that at the end of 6 weeks, for the responders, they see quite a decrease in agitation score, and the delta between the responder and non-responder is around 4.82. So overall, in conclusion, what the study told us is basically the patients responding to psychotic symptoms show improvement in agitation and aggression symptoms as well. Benefits is seen for both baseline and severe patients. And the authors made one more additional statement, which is basically the improvement in the psychotic symptoms, which is delusion and hallucinations, are related to the improvement in agitation and aggression as well. So they go hand in hand, meaning that if we see improvement in the psychotic symptoms, then they would definitely going to see improvement in agitation and aggression. And the mechanisms driving the agitation and aggression in AD is still under investigation. Like we have seen in so many places throughout this course, a lot of the root cause problem is still unknown, and even in AD there is a lot of questions. And in case of psychosis and in case of agitation, still we don't know exactly what's the root cause. Is still under investigation. But one thing that is certain is like there needs to be distinct type of treatment for each of the type of agitation. And the further study needs to be done for patient exhibit only agitation and aggression, but not psychotic. So there are people who are having Alzheimer's disease, but they exhibit only agitation and aggression, but not psychotic. Psychotic here means the hallucination and delusions. And if they don't express psychotic symptoms, but they express agitation and aggression, and they want to take the next step of taking those patients and see if this particular drug is beneficial for them. Thank you for your time.